Well, so far, sub-Saharan Africa has largely escaped the pandemic, but will that remain the case? Amara Konneh was the Liberian finance minister during the Ebola crisis, which began in 2014. He's now a senior advisor at the World Bank in Washington, from where he joins us live. Thanks for joining us, Mr. Konneh. And I know that you helped manage Liberia through that terrible time, and it was clearly devastating for your country, thousands of cases and a very high death rate. Do you fear that this could be worse?
No, I think that this crisis is horrible. It's very difficult to absorb, the rate at which it is spreading. But I'm confident that when the international community comes together, they will continue just as they have to continue Ebola epidemic. But I think there are clearly lessons from the Ebola crisis that can help to do that.
And what do you think those lessons are?
Well, first, the international community, we have to come together, be transparent about this, communicate clearly, but most importantly, given the scale of the spread and the interconnectedness of our world, to share information both at the global level, also at the regional level, information on contact, tracing, information on surveillance, would be really helpful. That's number one. And the information has to be concise, clear, and honest. And then number two, we need to take into consideration the impact of culture and fear. I heard that, soccer will continue in Europe. Soccer in Europe is like religion in most parts of the world. In our case, religion helped to spread the disease faster because in times of crisis, most people turn to their God, for comfort. So this is the time to think through about the policy of social distancing. The policy of huge crowd gathering in one place was not helpful in our case. So I think that policy ought to be reviewed and carefully implemented in ways that it protects people from gathering in one location.
Yeah, I mean, the experts here say that, this may be more dangerous because it spreads more easily. Are you concerned that African health services and African economies will not be able to cope with a really serious outbreak?
Well, let's establish first that this is not Ebola, in a sense that Ebola, you could see the symptoms on the affected person in many ways. It was physical. But according to the health experts, coronavirus is respiratory, which makes it very silent. And so in that case, Africa is vulnerable. Africa and smaller and emerging countries are particularly vulnerable in the sense that they have very, poor health infrastructure like we did 5 years ago, but also their economies don't have the ability to withstand the shocks of an epidemic of this magnitude, which would not be felt right now. I can tell you that the shocks, the economic impact on these smaller countries, on these fragile countries, would be felt perhaps in a quarter, because the continents that are currently being affected, Asia, Europe, North America, are the three biggest trading partners for emerging smaller countries, majority of whom are in Africa.
Yeah, and just finally, I mean, it's not much of a problem in Africa at the moment, but is that because not much testing is going on? Do you fear it may already be in Africa quite substantially?
That could as well be the case. I think a few countries have reported incidents in Africa, from Egypt to Nigeria to Ethiopia to Burkina, and then yesterday to Cote d'Ivoire. But also, I think one could say that Africans are accustomed to pandemics, so they have learned a lot as well. And also, during the Ebola crisis, after the Ebola crisis, significant investments have been made in the capacity of the continent to do surveillance and share information. For example, during the Ebola crisis, the Africa CDC was silent. But on this one, it has been very vocal. It has been talking. It has been communicating with the various surveillance bodies in the various regions in Africa. And I think that's helpful. And then finally, I think the experience of Ebola prepares African countries to work with their local communities, to work with their religious leaders, to take proactive measures to deal with coronavirus. But I have to emphasize that in economic terms, a lot needs to be done. I think the West and the richer countries should share information with Africa as much as possible, and also give them support in economic terms, you know, so that they can address this situation.
Yeah. Okay, Amara Konneh, we appreciate your time. Thanks very much for joining us this evening.
Thank you.
This is a Sky News special programme on the virus outbreak. Coming next, we'll be answering some of your questions on the latest developments.